to propel, right? Okay, so to propel forward, just push the two handles forward. So initially, this is the 12 o'clock position. 12 o'clock. Kasi if this is the clock, 12 o'clock. Okay? So yun yung 12 o'clock position. Arms are slightly flexed at the elbows around 30 degrees. Around. Okay, so ganun. So to propel forward and backward, hilahin lang. So if you want to turn to one side, what do you do? Let's say if I want to turn going there.
You turn one side. You just turn one side.
Turn one side left. Okay? But if I want to turn using a smaller diameter, radius, sorry, I hold on to this one or pull on this one. Pull and then push. Okay? Para nagpipivot lang ako as compared to creating an arc. Okay? Ganon din, pag nagpropel ka ng chair, dependent yung mag-propel. So kung may pasyente ako na nakaupo, okay? So pag iikot kami, so usually iikot ka pag gano'n eh. Okay? Pero kung limited yung space, then you would hold on to this side and push with one side. Okay? So to decrease the turning radius. Questions? Can you imagine this? Yes. Okay, so that's for propulsion. In instances wherein you have a hemiplegic patient, so isang side lang, di ba may hemi chair na na-discuss yung TP? So you have two what's this?
Hand rails.
Hand rails. This one is called hand grip. Grip. Okay? So meron kang dalawang hand rim on one side, a bigger one and a smaller one, which controls the same wheel. The smaller one or the bigger one? The bigger one. The bigger one controls this wheel, the same wheel, and then the smaller one on the opposite side. Okay? Okay na. So, hawak mo, if you want to propel yourself forward, you hold on to the two hand rails and then push together. Okay? If you want to turn, let's say, going to the left. I want to turn to the left. Which wheel should I hold on? Which hand rail?
The bigger
one. The bigger one or the smaller one?
The bigger one.
The bigger one, I push it. Okay? I push it forward para makaikot ako doon. Okay? So sometimes, mahal kasi yon yung double. Okay? So for household ambulation, you buy a standard chair. Have it you buy a medyo a little bit lower na chair. Okay? Tapos, yung weak side, nakapatong, I use my arm and my foot to propel myself. Indoors lang na, indoors. Medyo weird kapag nasa mall kasi ginagawa. Okay? So, for independent, function. So, what I do, I propel with my hand, I control with my foot, whichever way I want to go. Okay? For hemi. Okay? Pagka instances naman na weak yung dalawang kamay, strong yung dalawang paa, okay? Paano mo, anong klaseng wheelchair ang gagamitin? Pedal. Maglakad ka na lang, strong naman yung paa. Oo, hindi, pero kunyari, instances wherein poor trunk control. Okay? Hindi ka makalakad, hindi ka makatayo kasi wala kang trunk control, pero may strength yung lower extremities mo. So, you buy a wheelchair na mababa, wherein yung paa mo naaabot sa floor. Tapos paa mo na lang yung gagamitin mo pang okay, pang forward, backward. Dapat mababa, mataas kasi sa akin. So, dapat ganyan. Ayan. Kaya. Para lang makaikot ka sa bahay. Kung ako, may sandalan yan okay, may sandalan. Pwede ka rin bumili ng mga office chair. Di ba may gulong yun? Mas mura yun eh. Yun na lang. Yung computer chair. Mas pwede pa i-adjust yung height na. Leather seats pa, di ba? Okay. Ayan, pwede. So, yun yung mga options natin for our patients. Okay? So, if prescribed, let's say your patient comes in, may dala na siyang wheelchair, tapos kitang-kita na hindi fit yung wheelchair sa kanya, we give them options. Let's say, yun nga, add pillows underneath to elevate the height. Pa-welding nyo pakat nyo yung metal, tapos bawasan ng konti para bumaba yung arm height. Mga ganun. Pwede. Reupholster para hindi siya masyadong mataas. Pwede naman i-request yun. Especially if your patient will be using the wheelchair most of his waking time. And for long period of time or forever. Magandang fit sa kanya yung chair. Ang problema lang dyan is yung mga bata. Because they grow up, and yung chair, you need to buy a new one, or yung growing up chair, or growing chair, or we can buy a standard one but add yung mga extra features that we can detach later on para hindi na masyadong bibili ng marami. Questions? Okay. Sir, next.